Welcome to the Friendly Moms Club podcast with Jen and Karlee. We're the new mom friends you didn't know you needed.
We are creating a safe space to bring moms together, lighten the heaviness, and find joy in the everyday moments. Together, we will share our own experiences of being new moms while navigating the topics we wish more people talked about.
Join us every Monday to hear us skip the small talk and dive right into the uncomfortable.
Hello, happy Mom Day, Karlee.
Happy Mom Day. How exciting. We're back in the old studio.
I know, it feels like it's been a while, but we've just been doing a few episodes separately, so it's kind of sad. We haven't been together as often lately.
We've been cheating on each other.
I know. It does feel kind of weird, but we are together.
But it was almost like
today.
It was consensual, so it was like a polyamorous podcast.
We're back. That's what matters.
We're back, baby.
Yeah.
We're back.
You didn't comment on what type of day it was today.
Oh, see, it's nighttime. Maybe I'm just too tired to recognize what's happening in the world anymore.
It's a beautiful day. I don't do it the same as you.
I
but
know,
it's
a beautiful day.
Thank you. That was actually, that was one of your better ones. That was pretty good.
Wow, that's like my man opera voice. It's my, that's it. But it actually was a poo-poo day. It was ugly out. And yesterday was hot AF and sunny. And then today, blah, blah.
You know, from one sweaty girl to another, I'm okay with it being like the spring weather still. Like, I don't know if I'm ready for those in the 30s degree weather days yet. I would just like to not sweat for a little while.
I'm absolutely
like,
not ready for that.
I'm happy to have another month of like nice, cool spring, crisp weather where I'm not sweating through everything.
But we'll still be sweating, just not like, we'll still be dripping. I was going to say we won't be dripping, but we will be. Yeah. We're sweaty people. So you had a baby. There's that.
So, yeah. And we are actually going to get into the birth story today. We thought it was time that we kind of go into a little bit more detail about how Peyton was brought into this world and how it went with
she
baby
came out
number
of you.
2.
Isn't that wild that like she was inside of you and now she's outside of you?
But what I'm most excited about is that I never have to do it again.
Yeah, she'll never get back in. There will never be a creature leaving your body.
To experience
be pregnant.
This.
Yeah.
Yeah.
Because birth-wise,
pregnant.
You're pretty good at birth.
Wasn't so bad. Yeah.
Pregnancies, poo-poo.
Yeah, pregnancy's so bad though that I think it makes birth
enjoyable.
Like, yeah, because it's like the end of the storm. Like, you know, you could like you see the light at the end of the tunnel. It's manageable for me, whereas the pregnancy, that's the terrible part. So really, the birth was pretty good, I guess, in the end.
Before we get into this real quick, I can't remember if we talked about this or... Anyways, I would rather give birth once a month for the length of a pregnancy than be pregnant. What about you?
Okay, so I would say that I would choose that. However, I just don't think that would happen because I had C-section. So I don't think you can actually physically... You know what I mean? Like
no, but like say you had to go through that recovery, like the whole process of it once a month. Maybe once every 2 months for a C-section.
Yes, no, for sure. I would much
rather I do it every day
than be pregnant because I hate it that much. And then at the end of my pregnancy, of course, like me fashion, something had to kind of happen. And I started having all these weird symptoms. And I just think that my body hates pregnancy. And that's why
I agree.
It does this to me.
So your first birth was a booked C-section. Your water broke and you ended up having like on paper, like an emergency C-section, but it wasn't like a running to the OR. It was like you had to have a C-section because your water broke and you had a booked C-section. Yes. And then this one, what was your plan for the birth?
So because I got pregnant so close together, and typically to have a VBAC, they like to have 18 months at least in between your births. And I was only going to have 16 months. And so
that's
already
a vaginal birth after cesarean.
Yes, that's
for
VBAC.
Those listening.
Sorry.
Yeah. You're like, I'm up with the lingo.
And I wasn't sold that I needed to have a VBAC or try. But anyways, then I went and we talked to the midwife and OB about it. And they were kind of like, you don't really have 18 months. Like I would just recommend doing a C-section. And I was fine with that. So, but there are some like risk factors and... It
would be strongly discouraged at 16 weeks or 16 months. I'll say that. There's like specific criteria you have to meet. And then also considering the reason you had a C-section in the first place is also a factor in deciding whether or not whether a doctor would recommend it. And but like most people can try for a VBAC, but there are some safety concerns.
Yes.
And then there's also like when you're in labor, there's additional safety measures that are recommended. If your uterus has been sliced open, then you're at risk of it rupturing. And
yes. And the risk factors weren't worth it to me
mm-hmm.
fight to have a VBAC. It was not something that I felt strongly about. And so I was happy to have a scheduled C-section again, because that also gave me a sense of control. And having a second child at home, I was like, oh yeah, like knowing when this baby's going to be here is actually kind of nice when you're dealing with daycare and we needed someone to come. And I know, then it all went out the window. But that was my thought process. I'm like, oh, this is actually kind of handy, because now I can plan. My sister took the day off work because it was scheduled for a Friday. And so she had the day off work and was going to have her all weekend. And then my sister only had to take the one day off. It was perfect. Like, it was all planned. It was all going well. I say that in air quotes because my pregnancy sucked. But it was all going well until it's probably like 34-ish weeks that I started having just some other weird symptoms. And because I didn't feel great in my entire pregnancy, it was kind of like, it didn't stand out too much to me because I felt crappy all the time. Like if I wasn't throwing up or nauseous, I was on a lot of the medication for that, which already made me not feel very good. But I just started having this headache that wouldn't go away. And I was kind of like, oh, this is weird. Like I tried to take Tylenol, nothing really helped. I thought maybe I was dehydrated because, the throwing up and nausea, I wasn't eating and drinking very well and it wasn't active. And like, it was just, I kind of thought I was just doing it to myself. And so I had this headache that wouldn't go away. And then I started seeing stars. And at first I only noticed it more when I was moving, but then it started happening when I was just laying down. So like I would just be laying in bed. I don't even know what I'd be doing, just laying there. And I would just see like little like lights or stars like flickering around. And just in my experience, I was like, oh, I think that's normally like lightheadedness. And normally if you're lightheaded, it has to do with your blood pressure. So of course, not the nurse here. I was just like, oh, I'll check my blood pressure. So I checked it and it was almost 140/90. And I was like, oh, that's high. Like that's weird. Normally I'm in the like 110/70 or something. Like it was quite high.
Did you think you were going to have low blood pressure when you checked it?
Yes, because I was like, oh, I'm lightheaded and I'm seeing stars. So I expected it to be lower than normal. And also doctors kept telling me that the medication I was on for the nausea and vomiting would lower my blood pressure. So I just expected it to be low. So then when the number came up, I was like, huh, that's high. The headache and the like seeing stars had been a few days, like it had been a few days coming, then I just kind of put it off. And then the blood pressure, I was like, oh, that's not good. And then, of course, I look at Google. And I was like, I feel like high blood pressure has to do with preeclampsia. Like, I should probably Google this. So, which is like famous last words. You should never Google any of your symptoms, especially in pregnancy, because it is always like the worst news ever comes up. And I have Karlee to message. I should have messaged you right away. I think I did message you, but at first I Googled. And then Google comes up.
While you waited for my reply. Yeah.
Preeclampsia and it like all
You're
these
gonna die.
words and fetal and maternal death. And it's everything on Google says really bad things when you look at preeclampsia. So I just kind of had these symptoms. And so I was messaging with Karlee and I guess with you. I don't need to say your name, but I was messaging with Karlee. I just kind of was like humming and hawing and I ended up calling the hospital because previously you could do that and they would give you medical advice of whether or not you could come in or not. And then they changed their rules. So last pregnancy, this is what I did. And they said, oh, you're probably your water broke, come in. And this time the lady on the phone was like, I can't actually give you medical advice, but you should come in. And I was like, okay, I'll talk to my husband about it, blah, blah. She's like, no, just come in. But I can't give you advice, but come in. Like, you should come in. And every time I kept being like, okay, I'll like see how I feel. She kept telling me like, no, come in. So I was like, maybe I should go get this checked out. And that's what you said too. Like, may as well err on the side of caution and go get checked out. Long story short, I ended up being at the hospital almost every other day for almost 2 weeks. I just had to keep going back because as soon as they started to do blood tests and urine tests, I had some markers come back that suggested it was preeclampsia. But everything for me was coming in periodic waves. So my blood pressure would be really bad, but then it would be totally fine. They would check it multiple times and it would be fine. And then it would be really bad again, and then it would be fine. And then it's same with, I was getting swelling, but the swelling would come and go. It wasn't just, I was swollen all the time, but my hands would get really, really like, you know that when they get so big and they're like white everywhere? Is that a normal thing? Or is that because I'm really pale? Anyways, so they were all like weird colors and they'd look like sausages, and then it would go away and everything would be fine. And so they were kind of humming and hawing. And so they basically said, we're diagnosing you with preeclampsia. We need to check on you. Come back every other day, and we're going to do urine test, blood test, and a non-stress test every time. So every time I went back to the hospital, it was hours. Like I was there for probably on average 3 to 4 hours.
Yeah.
And not because they were slow, just because
you're the bottom of the totem pole.
Until like they're doing blood work and they need to wait and get all the results back, which just takes a few hours. Like I'm not an emergency, right? The non-stress tests were always fairly good. Like they never had any concerns about baby through all of them, which were really good. It was just the concerns about my symptoms.
And I should say a non-stress test for those listening, if you're confused. People also call it an NST. It's just a test looking at baby's heart rate and any uterine activity, so contractions. Doctors, nurses, midwives, they use that as a way to see what's going on with baby. And it's how to determine the status of baby and how they're doing inside, because they're inside, so they can't tell us anything, and we can't assess them the way we can assess, mom. So, or the birthing person. So then we assess baby by looking at their heart rate. And then non-stress just means you're not in labor. So it's not a stress. Baby in a calm environment. Yeah.
Get hooked up to this little strapped in, and you have a little clicker. So every time you feel movement, you click. I've done a lot of NSTs now in my life. So
you could probably do one.
I probably could and read it. But the heart rate was always good. Like baby was always chilling. They were always, I guess they have to see so many different things on their screen. Like they want to see so much activity. And because she was so active in there, like they was always really quick, that non-stress test. Like I never had to go for very long. And I guess some people, they make you like get up or drink water or do things to help move baby so that they can get these things on the screen. Again, no nurse here. So my technical terms, they wanted to see these little...
She's doing squigglies with her hands. What we're looking for, we're looking for an acceleration in the heart rate. So, when you walk up the stairs and you do some movement, your heart rate goes up and down because when you exert yourself. So we're looking for those increases in heart rate because that's a sign that baby has good reserves. That means baby's getting adequate blood flow and they're able to move around in there, and then elicit also a heart rate response to match the little movements they just did. So if you're not getting any of those accelerations or accels, then it doesn't mean that something's wrong, but when you see them, it's a reassurance that things are okay. So that's what they're looking for.
Baby was just moving so much that they saw those so frequently.
Oh yeah, they were just happening over and over.
Never any concern because they were like, oh, this is great. Like we don't have to worry about baby at all. And they also did another detailed ultrasound because they just wanted to make sure I had amniotic fluid, everything.
For growth and...
I was going to say, everything was still closed up and good in there. Like it was, So I had another detailed ultrasound where everything was good too. So there was really no emergencies, but I was still having these symptoms of preeclampsia. So that is why they wanted me to keep coming in every other day until I got at least to 37 weeks, which I can't think of the term. That's technically full term. Yeah. Right?
The term is term. Fully cooked.
That's embarrassing. Can we edit that out?
No, keeping it in. She stays. Term.
So they wanted me to get to at least term because, and then they were going to discuss doing a C-section earlier just because of my symptoms. And we'll get Karlee to go into preeclampsia and kind of a little bit more detail about it because there are dangerous risks associated to it. They just they were weighing the pros and cons.
So when you get to term, then the risks of keeping baby in are greater than baby coming out and just being on the outside world. Where if someone has preeclampsia at 29 weeks, the benefits of keeping baby in, even an extra day, significantly outweigh taking them out and trying to cook them more on the outside,
Yes.
Yeah. That's what you're getting at, right?
And after the ultrasound, they were like, baby looks great. Like baby's a very good size. Like they had no concern about baby. So they were like, baby's healthy enough to come out now. And it wasn't worth the risk to keep baby inside. So there was no decision made.
And I was
miserable. Well, going back to the hospital every other day. So like every time I went, something was different in my blood work and they would hum and haw and like it just was not enjoyable. And I obviously couldn't, like my husband couldn't go to every appointment because we have another child and it just wasn't feasible for that to happen. So my mom came a couple times, but I also just went by myself a couple times. And every time I was like, is today the day? Like, is something going to come up in my blood work? And I already have a lot of anxiety. So if you add anxiety, and I was diagnosed with depression and generalized anxiety disorder in this pregnancy again. So if you take all of that into account and be told, come in every other day, stay for hours, we're going to test everything. You could have your baby at any time is essentially what they kept telling me. Like, oh, maybe today. Oh, no, we're going to wait till next. Oh, no, maybe today. Like they just kept, it was so anxiety inducing. And you were the one who encouraged me to even say like, I'm not doing well. Like mentally, this is really, really hard on me. Like I'm okay if baby needs to come out, and making sure that that was known, that that was also my wishes, because I was really not doing well at this point. But yeah, let's do a little interlude for you to kind of maybe go into preeclampsia a little bit.
I'll do a little spiel, a little nurse spiel on preeclampsia. So big, long, scary word. And if you Google it, Google tells you that you're going to die and have seizures. But essentially, the lingo is kind of changing in the healthcare world, but we're resistant to change. So it's not really changing that quickly. But now the like big umbrella is hypertensive disorders of pregnancy. So that just means high blood pressure in pregnancy. Preeclampsia specifically is any high blood pressure that happens after the 20-week mark of pregnancy that either is accompanied by protein in your urine, urine. So when they do that P test, the lab one, there is protein in there, or there is evidence of end organ dysfunction. So your kidneys or your liver your blood tests are showing that those are being affected. So other things underneath the umbrella of the hypertensive disorders of pregnancy. So there's just having hypertension, so just having high blood pressure without having the protein in your urine, and then not having any of your organs affected. So your labs would then be normal. And then after that, it can turn into preeclampsia, is if that's when you start getting that protein or your labs are off. And then what they're trying to prevent is eclampsia, which is when you can have seizures. And then there's also like a little subset that's related, and it's called HELP. So it's hemolysis, elevated liver enzymes, and low platelets. This is a completely different thing that can happen. You've probably heard about it on Grey's Anatomy, so we won't go into too much detail, but that one also is very serious. You often need ICU stays. That one is significantly less common, but it can happen. So if you hear about HELP syndrome, that's kind of an offset of that. Perinatal Services BC say that preeclampsia happens in 2 to 8% of pregnancies, which is actually pretty common if you think about it. If you have I was going to do some math, but I don't want to. I was going to say if you have 50 friends, that means 4 of them will likely have preeclampsia.
It's likely that you know someone that had preeclampsia. It's
yeah,
likely
I mean,
someone in your
you know both of us. And
I know, and both of us had it now. So
yeah. And what's really interesting with it is because you think, oh, high blood pressure, it's completely lifestyle related, but it's not like essential hypertension. So like high blood pressure that you get from lifestyle factors. We don't really understand the cause of preeclampsia. It has something to do with the way that the placenta attaches in the uterus, and there's something that went wrong with that attachment, which then leads to the mother developing high blood pressure. It's not really clear why this happens, but it happens.
It's not your fault.
It's not your fault. There are risk factors. There are things that can increase your risk if you already have essential hypertension, if you have any chronic issues, if you have an autoimmune disease or diabetes, if you've had preeclampsia before, or if you've had high blood pressure in pregnancy before, if you have like a family history of it, and if you were overweight when baby was conceived, or if you're pregnant with more than one baby, so twins or triplets. And oddly enough, if you're pregnant for the first time, you're also at a higher risk of getting it. And if you're older than 35. So there's a few lifestyle factor things in there. I believe also any kind of reproductive assistance, so like IVF, can also increase your risk. So essentially, the main symptoms that you would be looking for is first, high blood pressure. So high blood pressure in pregnancy is anything either number over 140 or 90. So like a air quote normal blood pressure is like 110 over 70 to 120 over 80, kind of in that region. And if in pregnancy, if your blood pressure, if either number, the top number or the bottom number, go over 140 over 90 in more than one reading, then that is considered high blood pressure in pregnancy. So that is the first thing, that like the first clue that people are looking for. And then a few other really common symptoms are a really awful headache that's like in the front of your head that it won't go away even if you take Tylenol. And it's like a really painful, persistent headache that just won't go away. And then another one is those visual changes that Jen was talking about. You can get spots, you can get like little floaters, you can get blurriness, stars, just any changes from what is normal to you. Some people will get really nauseous and vomit. The sudden swelling is also a really common one. You can also get pain on your right side, so up where your liver is. So like underneath your rib cage, if you're getting like a weird pain in there, that could be a sign that your liver's being affected. We're also looking for things like you're not peeing as much. And then also you might just like feel really unwell. You can have trouble breathing too from the swelling. You just would feel really crummy. And that's most likely if you were like going into preeclampsia, just having high blood pressure in pregnancy, you may not have any symptoms. So that's why most of the time your doctor, your midwife will want to see you every week at the end of pregnancy when you're most likely to develop high blood pressure, and just keep monitoring you really closely. If you have white coat syndrome, so that's when your blood pressure goes sky high when it's getting checked from somebody else, which is something I really struggle with. So I was actually checking my blood pressure at home every week, because when I'd go into my midwife, it would be like 190. And she's like, I know that's not your blood pressure. And I'm like, it's absolutely not my blood pressure, but I cannot have other people check it. So I was checking it all the time myself. And that's how I found it. Well, actually, no, I got a headache and I was like, okay, I just deep cleaned the stairs. Like I steam cleaned all of the stairs, like aggressively with this really stinky, like gross,
yeah, because why not do that when you're super
soap.
pregnant? That makes sense.
I know.
Doesn't everyone do that?
Was like, these stairs will be clean. So I was like, well, I might have a headache from that, or I have preeclampsia and I'm going to die. But, and they're like, why are you steam cleaning your stairs? Like all your carpets. I'm like, well,
it's a great question.
Because I was. And the cure for pregnancy, the cure for preeclampsia is getting the baby out and getting the placenta out. It can actually take up to 6 weeks after baby is born for all of the symptoms to go away. So preeclampsia and high blood pressure in pregnancy, you can get it anytime from in pregnancy, during labor, or you could even have it start postpartum, like after you've had baby. And the symptoms typically get worse on day 3. So a lot of times people, they have their baby and they're like, okay, I'm healed. And then their blood pressure spikes and they have like a little bit of a hypertensive crisis on like day 3. Very common. And then everything mellows out and slowly gets better. I was on meds until like week 4, week 5 after having Henry. Like it really lasted a long time. And then the way that they treat it is medications. And there's like a few different ones. I'm not going to get into that, but medications. And then you want to be monitored more, because if you have high blood pressure, you're having less blood flow to all of your organs, and one of those organs being the placenta. So you want to make sure that baby's getting enough blood flow. So like what Jen said, she was going in for those NSTs, those checks on baby, and blood work, and getting her urine dipped every few days. So if you develop it early, you might be going like once a week. And then near the end, you could be going every day, every 2 days, every 3 days, just getting yourself and baby checked.
And I was checking my blood pressure at home in between all of those too. Again, when you have anxiety already,
it's
and
so
any
tough.
Little thing, right? It just, this was just an added complication that I didn't need. It honestly was terrifying, but now that I've gone through it, I guess, like I was so closely monitored. They were so on top of everything. I felt very cared for. And it was honestly way better that happened, because the end of my pregnancy, like I knew everything was fine because I continually went in. You know what I mean? Like it worked out in the end, in that I was getting monitored closely. I knew that if anything was going to happen, I was in good hands. Like I was doing everything I could. There was nothing else that I could be doing. It was not the way I wanted to end my pregnancy, but alas. So all of this was happening. And so again, going in every other day, and they wanted me to get to terms. They wanted me to get to that 37 weeks, and then they were going to reassess, like, should baby come out? When should baby come out? As soon as we hit term. So they said this, and as I got to 37 weeks, I had another appointment to go in the next day. And so because we were at 37 weeks, I told my husband, like, you should come for this one. Like, let's be prepared. And they kind of hinted, like, you should be prepared for baby to come anytime. Like, this week on, anytime you come, be ready with all of your stuff. Like, baby could be here. And so it happens that we had a snowstorm, which if you live in the Lower Mainland, that does not happen very often. And so we still needed to drop our daughter off at daycare because we didn't have any other plans for her. So We dropped her off at daycare. So it was the slowest morning because it took us forever to get to daycare through the snowstorm. And again, then going all the way out to the hospital. We had to go through like several different cities. We were not close in any of this. But anyway, so hours later, we ended up getting to the hospital for my appointment to, again, do the urine, to do the blood test, and to do the non-stress test. Did blood work, did urine, and they hooked me up to the NST. And within like 30 seconds of the NST starting, Peyton's heart rate actually dropped really low. And of course, like everyone's playing it cool. And I saw that it was really low. And right now I can't remember what it went to. But I know I have anxiety and I was just like, you know what? They'll tell me if something is wrong. Like, no one's telling me anything. It must not be that bad. Like, I'm no nurse or doctor. What do I know? Like, they'll tell me if it's bad. So I was kind of like, you know, doing the side eye, like I kept looking at it and it was just low for a while. And the nurse kept coming in. And then eventually she came in and she's like, when's the last time you ate or drank anything? And then, so that was the first sign of like, I feel like maybe baby's going to come today. Luckily I hadn't had anything to eat or drink. So that was fine. And she's like, okay, just don't drink anything else. Like, make sure you don't eat or drink anything else. Okay. And then she left. So I looked at my husband. I was like, I feel like that you'd only say that if I was going to be having a C-section. And so,
which is also kind of funny. She didn't, like, I find it sometimes so frustrating when, like, you know something's going on and, like, you could have been spiraling. And, like, it's tricky for nurses because we're not technically supposed to, like, tell you any, like, diagnoses or anything. But, like, we can tell you something that you can also see on the monitor. Like, and like, no shame to them because you had great care there, but even just saying, hey, you know, like, I'm feeling a little concerned about some of the things I'm seeing, so I'm gonna go check in with the doctor and, like, prepare yourself. We might go and have a baby today. Maybe, you know, like, just instead of, you know, like, sometimes I'm like, just tell people, like, they know what's happening, but sometimes they don't know fully and they're panicking, you know. Anyways,
and it was,
side note, they
were great. I really did love the care that I had, but I just felt like, I was like, you know, that I know, like, you're telling me things and I know that means surgery. Like, you know, I've been through a C-section before. I kind of knew what to expect. And so anyway, she had said that. So then we were kind of waiting and the heart rate came back up, but it was down low for quite a few minutes. And then it kept going decelerating again. So it kept dropping again. So the opposite of, I guess, what they want to see is you want to see it going up, and hers kept dropping again. So it wasn't staying low for a long time, but it kept dropping it again afterwards. And so eventually the OB comes in, like, doesn't take a very long time, but he comes in after he was in a C-section when this was happening, and because they had said that. So he came in and he's like, okay, well, I'm just taking a look at everything, and I think we're going to meet your girl today, your baby girl. I think you're going to meet her. And so I was like, okay, like, we're going to have it today. And he's like, here, Dad, here's your scrubs. Go get changed. The OR's being cleaned and you're going to go have a baby. And I was like, oh shit, like, this is happening like right now. Like, he was just so calm and like, you're going to meet her today, like, now. And I was like, okay, we're going now. And it was the next day that my midwife came in and she's like, yeah, we always thought it was going to be you. Like, you were going to be the reason baby came early, but it ended up being that baby was in distress. And I was like, no one said those, like, no one once said that to me. And looking back, I can see that they were worried now, but I guess I just trusted the care, right?
Would you have been more or less stressed if they just told you? Probably
more stressed. It worked out fine because I knew that they were taking care of me and baby, but it was just funny because this happened. So they say, whatever, Dad, go get changed. So they hand him the scrubs. He goes and gets changed. They're taking my clothes off. They're getting me all ready to go. And they tell me the OR is just being cleaned. So as soon as the OR is ready to go, you're next. You're going in. And so we're messaging my family and try to tell them, like, oh yeah, baby is coming today, and arranging to make sure that someone could pick up Jordan from daycare and have her overnight. And so we're trying to kind of do this last minute. And they just kept checking. So eventually when they had to move me to the OR, they had to take me off the stress test. And initially they just kept me on it. So they said, for as long as we can, we're going to keep you on the NST, which was different because before they would, do the NST for 20 minutes, tell me everything's great and take me off. And this time they weren't taking me off of it. And then every time they moved me after that, they would come and like do the heart rate, and they kept checking the heart rate. Which when I had the C-section with Jordan, like they never, like I did the NST when I got to the hospital, and then they never checked the heart rate again, and then baby was born. Whereas literally they were watching the heart rate as he was just good about to cut me open. Like they just kept checking it So looking back, I realized that they were worried about the baby. Just no one actually said that to me, which again, I don't think it really matters because at the end of the day, they were doing everything they needed to do. Like baby was 100% of the time in good hands. I just didn't fully realize maybe that it was more serious than I knew. But anyway, so the OR is ready. So they get us in there and I kind of know a bit what to expect now. I've done the C-section before. So you go in and your husband or your spouse partner has to wait outside while they get you actually prepped. And so they're like asking me how I'm doing. And I'm like, yes, I'm doing pretty good. I'm pretty easygoing. And they're like, man, your husband though, he's stressing out there. Hey. And I was like, yeah, he's not doing well. They actually offered him apple juice at one point because they thought he was going to faint. He was looking stressed out.
Oh gosh.
And they're like, but you're so calm. Like he's really not calm. And I was like, no, he'll be fine. Like once we get going, he'll rally. It's okay. And so like we were just talking, like everything was totally normal. And they asked me how I'm feeling. And I said, great. And they're like, you feeling like nauseous, dizzy? Like, how's the headache? I said, no, I feel actually surprisingly pretty good. So anyways, they get me on the table and after putting in the spinal, what's it called? What's the
spinal? Yeah.
Anyways, after putting in that. And so if you've ever had a C-section, it's quite funny because as soon as it goes in, everything starts happening really quickly. Mm-hmm. So they're like, everyone is just moving you over, like throwing your legs up onto the table to get you like laid in position. And it makes me laugh. Mm-hmm. C-sections are wild. They're not this
I want to
gentle,
get a spinal for fun.
But it happens like in the blink of an eye. All of a sudden you're like, oh, like it's happening. And so they're throwing you, making sure you're all good and on there before you can't feel anything.
Did they do the really crazy tilt? Where they tilt you side to side?
It wasn't like a crazy tilt.
Yeah.
No, just a little tilt.
Just a little.
But maybe to me it just didn't feel like a big tilt.
Yeah.
But you just have to be slightly askew, right?
Yeah, it like works on gravity. So they like, if one side's more numb than the other, then they'll like tilt the bed a little bit. And like usually they'll tilt you one way, tilt you the other way. And then they like poke you and put ice on you to check how frozen you are. So if like one side is less frozen, they'll tilt you. But so that's why I don't
remember being tilted that much. But they did.
They might not have.
Anyways, they get me this and they throw me on the table. And so at this point, I'm not feeling much. And I'm like, huh. And I start getting really, really hot. If you've ever thrown up, you know that like feeling that you get the really salivation, like your mouth gets all
the wave
watery. And all of a sudden you get this like really, really hot, it just like comes over you. So all of a sudden I was like, I don't feel good. He's like, okay, I'm going to give you something. And he's great. And he's like, oh no, I'll give you the good stuff. And he's pushing that through. But as soon as that's happened, I couldn't even wait. I just puked everywhere. Oh. But when you're on the table, you can only kind of like look to your left a little. And the nice nurse like put one of those little like puke dishes, but it just went down all the side of my face and like down my neck because you
like
can't
eating it.
I couldn't move anything. Like you're numb up to like your armpits basically was how numb I was. And then I could turn my neck, but like it's just not. It was not
you can't
pleasant.
Like sit up to puke. You're literally puking lying down and like.
Yeah, so luckily I just kind of like turned my head over and she had the little bowl and anyways. I was like, this is just hyperemesis having its one last hurrah. And I think it's actually quite common to be nauseous on the table from what I understand.
It's from the medications, from the spinal.
Yeah, but I just said this is hyperemesis, just one last FU is what Nanette and I joked about. So after this happens, then your husband can come or your partner can come back in. So then they get Nanette and come in. And I was like, I just puked. I was miserable at this point because the meds hadn't kicked in. So I was still feeling really nauseous and like I was going to puke. But then within like maybe 2 more minutes, I was feeling great again. And like the meds they can give you, they are top notch.
Yeah, they got the good stuff.
They got some very good stuff. And then they started cutting me open. And from then it went so quickly. Like I felt like it was minutes before, like from puking to actually having Peyton come out. I felt like it was just a couple minutes. It went by really quickly. The C-section went smoothly and it was going really quickly. And I don't think I've talked about this really on the podcast yet, but I decided to get my tubes taken out as well. And so that was decided previously. I had met with the OB, and so we had to sign paperwork that I was doing a permanent family planning decision and taking my tubes out. It was decided with my family doctor and my psychologist and psychiatrist. We kind of all team decision that mentally and physically it was not a good idea for me to be pregnant again, and we were happy to not. I don't think I could have survived another pregnancy mentally or physically, and with hyperemesis, and I already had it twice. Like, I just was likely it was going to happen again, and anyways, we don't need to go into great detail.
What you're talking about is your fallopian tubes coming out. So they used to just tie them, and now they actually fully remove them. So you're not able to get pregnant naturally. You still ovulate. You still
your ovaries are still there. They're literally only taking the tube that's connecting your ovaries to your uterus.
Yeah. So the egg doesn't go to the uterus. So you could still get pregnant, but not naturally. You would have to do something like IVF. Not something like IVF. You would have to do IVF, but
there's no other option.
You could still donate eggs, and you could still be a surrogate, and you could still get pregnant through IVF. You just can't get pregnant accident. No more whoopsies.
Yeah, no more whoopsies, which is what brought us here to Peyton.
Not that you want to be a surrogate if you got your tubes out, but that's
no. But
just pointing out.
We were certain that we weren't going to be able to do this again. And so in talking, it's actually they said it takes like 5 to 10 more minutes in the OR, and there's no increase in recovery time. So it doesn't change how fast you're going to recover from your C-section anyway. So it's actually quite efficient to do it while you're already there, because now they're not having to cut you open again or do any other surgeries. You don't have to go back to the hospital. So if you already know you're getting a C-section and this is something you're interested in, I would talk to your doctor about it, because the least amount of surgeries or procedures you get done is better than the least amount of scar tissue buildup, recovery, all of that. And so it actually worked out really well. I felt like it was very quick. Peyton came out, and luckily she didn't have any health concerns when she came out. So with Jordan, they took her to the NICU, and it was kind of all crazy. Whereas this time, like, I could see everything that was being done when they were doing all the testing. It was kind of like right to this right of me. So I actually could turn my head, and I was watching them like weigh her and measure her and do all of that. Whereas with Jordan, it was like in a different area. So I couldn't see it at all. And it was at different hospitals, and I'm guessing it's just like OR setups and how it works. But in this hospital, I could see everything. So it was actually kind of like, as they were finishing and taking my tubes out, sewing me up, I could actually see her, and I was seeing what was happening. And they brought her to me, and I could hold her for longer. And it was just such a different experience than with Jordan, because they took her right away and I barely saw her. And this time, when they brought me into recovery, so after all of this, all was good, they brought me into recovery. They bring Peyton into recovery with me, whereas I was in recovery by myself, because Nanad went with Jordan to the NICU with Jordan. So I was just by myself. There was no one else even in recovery. Like, no other pregnant women were recovering either. So it was literally just myself alone and a nurse doing her charting. And it was just
awkward,
weird, and lonely
medical
and confusing.
Feeling.
And I had no idea what was going on, and it was just not enjoyable. So being able to go through recovery and have Peyton in the room with me and have Nanad in the room with me was actually a much better recovery. And we talked about this in the other episode. Now I can't remember, the breastfeeding one, talking about the differences so far. But the nurse actually helped me do hand expression and get colostrum and start feeding right away. And so I credit my ability to breastfeed right now. Like, right now I'm exclusively breastfeeding, and I credit a lot of that to that nurse that helped me and that was willing to help me hand express, to get skin to skin right away. Like, that, I think,
gold star.
It was phenomenal. And I had a lot of other support with lactation consultant before Peyton was here and afterwards. Like, there's other things that went into it, but I think that made a huge difference. And mentally, it made a huge difference to me too. Just knowing that they were there with me and we were never separated. It was pretty cool. I can see why people have home births now. And I never, ever would have ever debated a home birth before, but now I'm like, it would be so nice to never have that. Like, to be able to just give birth at home, be in your own bed immediately afterwards.
For it to not be like
space.
Medicalized. It's just
right?
normal and natural, like birth is. Like, it just,
Yeah.
Just pop a kid out and go watch some Friends.
Yeah. I'm watching Gilmore Girls right now, actually.
Same. Yeah.
But now that I know, and especially after going through 2 births now, and just, I'm so much more educated and I feel so much more confident in what should be happening. And I would really debate a home birth now, which is just crazy, because if you would ask me that 5 years ago, even 3 years ago. You mean like
going back to your first?
I never would have even considered a home birth. I would have thought you were a little nuts if you wanted to give birth at home. Like, why wouldn't you want to be in the safety of a hospital? Like, maybe that's also my PTSD and anxiety speaking. But
Because also, like, research does show that if you have like a low risk pregnancy and a qualified provider, home births can actually be safer because there's less interventions. There's less, like, your moms are actually able to get into the right, like, headspace. They feel safer and calmer, and there's less mucking around in the labor and causing what we call like the cascade of interventions. Like, it's more like, it's not medicalized. Like, birth is very natural, and
I can just see, like, my anxiety, if I could just be home, like, mentally, I know how much in a better space I would have been in. And I do fine with hospitals. I'm not someone who, gets stressed just walking in the doors of a hospital. I'm fine with it. I think super good people watching. I love going to hospitals and, like, seeing what's going on. Like, waiting in ERs is gold to me.
It's great.
Like,
great
love
people
it.
watching.
Yeah, it's so good. So, like, I'm not one of those people that even gets nervous going. But
like, when you're pregnant and you go to the hospital, they make you, and like they, as in like I was one of those people, they make you feel like something is wrong, that you're not just pregnant, and that, like, pregnancy is not a diagnosis. Like, it's not an illness. It's not, there's nothing wrong with you. I mean, there can be complications, but like average pregnancy, there is nothing wrong with you. But when you go to the hospital, you feel as if you're a patient. You all of a sudden are like a patient of the medical system. But like, it's not a medical thing,
Yeah. And I really had good births overall. Like, the second one was even better. Like, it went even with the whole preeclampsia, her heart rate dropping, it was a very, very, very smooth birth, all things considered. And it went really, really well. And my recovery was really good. I didn't have an insane amount of pain or bleeding. I didn't get an infection, anything. Like, my incision healed really well.
Definitely nice that you didn't get separated. That's always
yes, it made a huge difference.
Always a perk, little bonus. So that's how our little Princess P came into the world.
Yeah,
what we call the sunroof extraction.
That sunroof is closed for good now.
Yeah, she done.
Shut, never to be opened again.
So you plan to have a book C-section. Thrilled to have a date, a little baby date. And then Peyton was like, that's too easy. Let's throw you a little curveball. Give you a sprinkle
I think my body first was like, hold up. We can't make this too easy at the end for you. We need to sprinkle in a few other symptoms.
Keep you on your toes. Sprinkle in a little bit of this, a little bit of that. And then... Yeah.
My husband jokes. He's like, you just wanted more content for your podcast. And I was like, if only that would, like...
Yeah. No, how dare you use your pregnancy for engagement? How dare you? Oh, goodness. If you follow us on Instagram, you know that, well, we had recently had a reel where Jen had a quick video of Peyton when she was really sick and she lost her voice, and she posted it. And most of the comments, people were worried and, hope she gets better and all that. But there's one, I won't even say the word. And she really was not pleased with us for posting that. And you know what? If you disagree with posting videos of your children on the internet, that is fine. But you don't need to start 100 comment battle with some other. We weren't involved in it. It was just other people having like a full on keyboard war in the comments.
Yes, I purposely gave myself preeclampsia just for this reason, to talk about it with you.
You did. You manifested it. Well, that was the birth story. Tune in to never hearing Jen's birth story again.
Yay! And that is a good thing. Like, we are doing a happy dance over here. So please be happy that I have 2 healthy girls and I will never have to experience any of that again. So I
was going to say, if we weren't so tired, we'd be happy dancing, but we're both exhausted. So there is no happy dancing. But
I think I'm perma exhausted for a little while with 2 little ones now. So
life is rough. Being a working parent is no jokeroo. My goodness.
Yeah, it is not. But we're going to talk about bringing Jordan to the hospital and like the transition from 1 to 2 kids. So we'll talk about that in a future episode as well, because there's a lot to unpack with that. Lots of emotions.
I think we'll just have to do a full episode on transitioning from 1 to 2.
Thanks for tuning in today and listening to the birth story of Sweet Pea. I really liked that you called her that. I feel like now I'm going to call her that. I like that. Sweet Pea.
You're welcome to steal my very clever name.
Yeah, and we hope you learned something about preeclampsia, getting your tubes removed. Always good to hear other people's stories and learn something new. So, all right.
Go team. Okay, before we both fall asleep.
Thanks for listening. Happy Mom Day. See
We'll
you
catch
in 2
y'all
weeks.
in 2 weeks. Bye-bye.
Bye.